Hello, my name is Dr. Cathy Evans, and I, along with my colleague, Dr. Sharon Switzer-McIntyre, will be presenting this session on feedback. Do you get it? Receiving the formative feedback you need as a health professional learner. First, let's define what we mean by feedback. From the time we're babies, we receive feedback to help us learn and grow. There are basically two types of feedback. The first, summative feedback, the purpose is to evaluate student learning. It's provided after the student has completed a test or final exam. Second, we have formative feedback. This type of feedback monitors student learning on an ongoing basis to provide input to the student with the intent of helping to improve learning and ultimately performance. More specifically, formative assessments are used to provide learners with ongoing feedback to enhance their learning. This type of feedback is important for everyone, and especially clinicians and health professionals who need to learn complex skills and knowledge to help their patients achieve desired health outcomes. Feedback in health professional education has evolved over the years. Hundreds of articles have been written about feedback and its importance in helping individuals improve their performance. Several meta-analyses have demonstrated that feedback generally improves learning. Ende, in his seminal article in 1983, described feedback as occurring when a learner is offered insight into what he or she actually did, as well as the consequences of his or her actions. Feedback highlights the dissonance or difference between the intended result and the actual result, thereby providing impetus for change. The concept of feedback still holds true, but at the same time has evolved to include the idea of sharing of information. Brian Hodges at the Wilson Center in the University of Toronto considers feedback to be the sharing of information on actual performance to help guide and improve future performance towards a desired goal. We know that feedback is highly desired by learners to promote their learning, to enhance confidence, to develop skills, and to help learners self-assess. Unfortunately, it turns out that healthcare professionals do not do a very good job at giving feedback to each other or to their students. Clinicians often think they are giving feedback, but according to their students, this is not the case. For example, Ende found out that only 8% of medical students were satisfied with the feedback that they were receiving. That was in 1983. Have things changed much since then? Not really. Sende and Lieberman in 2005 report that although 90% of surgeons reported that they gave feedback successfully, only 17% of their residents agreed. So why is there such a disparity? One of the explanations provided by researchers such as Sende and Lieberman is that clinicians feel that they give adequate feedback through their body language and facial expressions, but learners don't agree. Clinicians feel they're giving obvious signals. A raised eyebrow, a certain tone of voice, or a frown were all considered to be forms of negative feedback by the instructors, but were not considered useful by students. Head nodding and casual comments such as "good job" or "you're doing as well as can be expected for your level" were also not considered useful by learners, although they were thought to be signs of positive feedback by the instructors. Internationally educated healthcare learners, who culturally may have different meanings and inferences associated with body language, such as eye contact, head nodding, and facial expressions, will experience even more difficulty interpreting these signs and comments as forms of feedback. So what can you do as a learner to ensure that you receive the feedback that you need?
I'm Sharon Switzer-McIntyre. During this segment, we will explore the stages of feedback. We're going to discuss 5 stages of feedback. These stages are modified from work done by Romani and Krakow at Harvard Medical School in 2012, when they reviewed the literature on feedback, and also on work done by Brown, Hodges, and Wakefield in 1995. As a learner, here is what you can do to ensure that you receive optimal feedback during your internships and clinical experiences. The 5 stages are as follows. Number 1, identify which behaviors you'd like to receive feedback about, and then ask your instructor to observe your performance. Number 2, be prepared to offer a self-assessment of your performance. Number 3, ask the instructor to describe or model the desired behavior and ensure that you understand the difference between what you did and the standard. Number 4, develop a plan with your instructor to close the gap. And finally, number 5, ask the instructor for a follow-up opportunity to demonstrate your improvement. Let's start with number 1, observation. Clinicians need to observe your performance and note specific behaviors that meet identified standards and those which need further work. One researcher, Bing Yu, found that learners tend to discount feedback unless it is based on direct observation, which allows the clinician to provide specific and relevant examples of aspects that went well and aspects that need improvement. Number 2, self-assessment. Self-assessment encourages dialogue and sharing of information. When you meet with your instructor after the observation, offer to start the feedback session with your honest perception of what went well and what could be improved upon. The clinician will confirm your perceptions in some cases, and in others may not agree. The clinician may think you were too hard on yourself, or alternatively, may suggest that you need to improve your performance in an area that you consider you are already competent. There are some things you should know about self-assessment. Educators and researchers have identified potential problems with self-assessment. Research evidence suggests that we are not always as accurate in our perceptions about performance as we like to think we are. In other words, we do not always know what we don't know, sometimes referred to as unconscious incompetence. What happens when the clinician does not agree with your self-assessment? Research from Hodges and others suggests that learners may dispute or reject negative feedback that does not fit with their predisposed perception of their abilities. Knowing this, it is important that you keep an open mind and spend some time exploring elements of the feedback that don't fit with your own self-assessment. Be prepared for the clinician to seek further clarification from you and also to provide their own perspective. Hopefully, a balanced picture of both the strengths and weaknesses of the performance will emerge. Ask for specific examples that will provide opportunities to help you learn to self-assess. For some internationally educated healthcare professionals, self-assessment can be a new experience. Some cultures have educational systems that are hierarchical, and the feedback is a one-way direction, from the instructor to the learner. It is important for internationally educated healthcare professionals in Canada to learn to self-assess, since reflection and self-regulation are essential elements of professional, lifelong learning and development required in an autonomous professional context. Number 3, discussing observed and desired behaviors. As a learner, you need to understand the difference between the observed and desired standard of behavior. The best way to achieve this understanding is through a two-way conversation. Generally, Canadian educated healthcare professional leaders are comfortable politely expressing their own opinions, even when it differs from a person in authority, such as a teacher or a senior clinician. Some instructors and learners like the sandwich approach, in which the instructor provides some positive observation on the things that the learner did well, followed by the behaviors which need to be improved upon, and then end with positive comments. The learner and clinician discuss together the examples of the observed behaviors and the ways in which behaviors both met and did not meet the desired standard. For internationally educated healthcare professionals, this two-way discussion may be a new experience. If you are an internationally educated healthcare professional from an authoritative type culture, you may be reluctant to offer personal opinions or to disagree with clinical educators and others in authority for fear of negative consequences, or simply because you're more familiar with listening respectively and quietly. Your instructor is likely giving you cues that they would welcome your perspective and a two-way discussion. Listen for phrases such as, "I'd like to hear your opinion on this," even if you don't agree. "It is important for me to understand your perspective." These are cues that your perspective on your performance is welcomed. But ultimately, it is your responsibility to offer your opinion respectfully, even if you do not agree. Remain open to considering the instructor's perspective. It is an important opportunity for improvement. Be clear and let your instructor know that you prefer feedback that is regular and frequent, includes standards or desired behaviors in the specified areas, is clear and explicit, and is discussed in a private place that is not in front of a patient, colleagues, or in common spaces. Number 4, developing goals. Based on the feedback, you can develop meaningful goals and an action plan for improvement. Once you have generated your goals, the instructor can confirm or modify the educational strategies to assist you in meeting your goals. Number 5, follow-up. Finally, follow up on the improvements. Ask for an opportunity to demonstrate that you have heard the feedback and are able to enhance your performance and demonstrate newly acquired skills and behaviors before the end of an internship, residency, or clinical experience. Now let's summarize. Formative feedback is the sharing of information on actual performance to help guide and improve future performance towards a desired goal. Feedback is multidimensional and requires observation, performance standards, two-way communications, and follow-up. Effective feedback can help enhance your performance. Ultimately, you, the learner, are the deciding factor in whether performance changes. Thus, our motto, feedback, make sure you get it.